Hey y'all, welcome back to What the OTPF. I'm Allie. I'm a geriatric occupational therapist and owner of the Good Life OT. Today we are further breaking down domain into another category, occupation. Occupations are basically a fancy word for tasks we need or want to complete every day. Within the OTPF, in this category, that includes activities of daily living or ADLs, instrumental activities of daily living, IADLs, health management, rest and sleep, education, work, play, leisure, and social participation. We will be breaking down each of those or grouped pieces of those in a later video to help you understand more what goes into each of those categories. That should be towards the later end of this series. But for today, we're going to talk about occupations as a whole and why it's important to our practice. These occupations coincide in step with other components of the OTPF. For example, our person's environment, how they complete a task, the physical, mental limitations that they may have when completing something. Do they need an assistive device or assistive techniques in order to complete a task properly or an occupation properly? We do hear a lot about ADLs and IADLs within our practice. That's considered what you would call the OT's bread and butter, especially if you are in an acute setting or a skilled nursing setting. We focus a lot on the play category with children because that's a big part of their daily routine. But I think it's important too to realize that there's several other categories that I feel like go relatively untouched. I will say leisure, social participation, and rest and sleep are big ones that I address as a geriatric OT that I don't see a lot of other clinicians diving into from a perspective of whole view scope, whereas it may just be some little piece that they address, but they don't realize that it's actually billable and it's something that we should and can check on as OTs. Something else I've noticed is how big these categories are and that they don't always fall neatly one by one. A lot of our occupations say even just getting ready in the morning may involve a habit or a routine that we've formed, but it may involve many tasks. Taking a shower, washing our hair, getting dressed, brushing our teeth. That's not just one specific category. That's many occupations that are now formed into an environmental setting, your house, and then in a routine or habit that you've formed within yourself. So each of those pieces are now going to be a bigger piece of that puzzle. That being said, something like grooming and hygiene may be important to you. However, your 85-year-old patient may really only find value in getting a shower, getting out to the golf course, and hanging out with his buddies. Whereas your 25-year-old female patient may want to focus on driving, getting out to eat, going out to the club, going to college, classes, whatever she needs to do to get back into her social life. So those might be big pieces you're looking for. But I think as an OT, we need to keep in mind how a new injury, diagnosis, pain, or some illness can affect each piece of those puzzles in each occupation, both together and separately, and how that looks very different for each individual. And that is why it's so important to know everything that we can practice and bill for as an OT so that we can better help our patients and justify our services. In our next video, we're going to be diving further into domain context. So stay tuned. Hope to see you then.